Hello, my name is Amanda.
Hi, I'm Andrea.
We are physiotherapists with a special interest in cancer rehabilitation and lymphedema management. Today, we're going to talk to you about some of the common impacts of cancer treatment after breast cancer diagnosis and some of the positive changes that you can make with as little as 10-minute sessions, no matter what part of the journey you are at. So, let's get started. We all know that regular exercise is important, but did you know there are significant and proven benefits specifically for people who are undergoing cancer treatments? Due to the nature of the various treatments, as well as other factors, cancer survivors have an increased risk of cardiovascular disease, high blood pressure, fatigue, diabetes, osteoporosis, muscular decline, lymphedema, and cancer recurrence. While this might sound overwhelming, research has shown that when exercise is used appropriately, it can assist with improving cardiovascular health, reducing high blood pressure, offsetting fatigue and improving energy levels, improving bone health, preventing muscle wasting, reducing the symptoms of lymphedema, and reducing the risk of cancer recurrence. This sounds great. However, research has also indicated that levels of exercise significantly reduce in those individuals after diagnosis of breast cancer. This is what Andrea and myself want to change. The biggest barriers that we hear from people currently undergoing cancer treatments in relation to exercise are, I don't know how to find the time to fit in exercise between treatments and appointments. I don't have the energy for exercise right now. I don't know if exercise is safe for me, and I honestly don't even know where to start. So, I propose that we start with the word exercise. Exercise means different things to different people. Normally, it has a negative connotation associated with it, where people think of images like lifting heavy weights at the gym, running long distances, or doing something particularly difficult and time-consuming. Instead, I prefer to use physical activity. Physical activity is any movement of the body that expends energy. This encompasses so many things, from aerobic activities like walking or hiking, swimming, dancing, skiing, to strengthening activities using your own body weight, using resistance bands, or even using dumbbells, to balance activities like Tai Chi or yoga. Remember, sessions of as little as 10 minutes at a time have proven health benefits, so you can use any of these activities in 10-minute increments. Doing these sessions of things that you actually enjoy will be easier to implement in the long term, and there are benefits for everyone at every stage of treatment. So, let's next look at some of the current cancer treatments and how these impact the body. Breast cancer treatments often include one or several of the following. The first, surgery. There are several different options for surgery in relation to treatment with breast cancer. One is a lumpectomy, which is removing a small portion of the breast. Another is a mastectomy, which is removing most breast tissue. And also, there are various reconstructions, which can include things like expanders for implants, or even taking abdominal tissue to create breast tissue. After surgery, you will require time to heal. So, what will physical activity look like in this period? Surgical incisions and tissues will require several weeks of healing, so make sure you listen to what your surgeon tells you for timelines. Now, in this phase, the most common impacts after surgery are restricted range of motion in the shoulder, postural dysfunctions, reduced muscle strength, and sometimes stubborn scar tissue. So, during this time, physical activity will often start with gentle aerobic activity, such as walking, and then things like movements of the shoulder to regain your shoulder range of motion, very gentle exercises of the shoulder to increase your strength, and as well as working on posture. The second is chemotherapy. Chemotherapy uses a combination of drugs to target cancer cells. These drugs are usually injected into a vein or sometimes taken orally as a pill. The most common physical side effect that we see when people are undergoing chemotherapy treatment is fatigue. Fatigue can appear suddenly and can be overwhelming. While rest may seem like the best choice, it often does not ease the feeling of fatigue and generally can make fatigue worse. When undergoing chemotherapy, it is really important to monitor your fatigue levels over time in what is called a fatigue diary. You can use a number system and check in 3 times a day to record where your level of fatigue is. Once you know the pattern, then you can do your most high demanding activities when you have the lowest levels of fatigue. Also, while it might seem counterintuitive, there's strong evidence that moderate and regular physical activity helps to reduce fatigue. So, what will physical activity look like when undergoing chemotherapy? Remember, you can start with 10-minute sessions and progressively add over time. Regular aerobic activity during chemotherapy is key. So, on chemotherapy, you may find that you have good days and bad days. So rather than omitting physical activity completely, try to find, using your fatigue diary, activities that are lower impact for you, such as stretching or yoga, and use those on the days when your fatigue is the highest. And the same goes for on days where you're feeling great, try to do an activity that is a little bit more strenuous, such as a hike. The third is radiation. Radiotherapy involves using high energy radiation to kill cancer cells. It is often applied to the breast tissue, the trunk wall, and into the armpit. Radiation itself is painless, but the cumulative effects on the skin and the muscle over time can become quite uncomfortable. Skin irritation, known as radiation dermatitis, is quite common. It involves red, swollen, and flaky skin that can sometimes peel. Radiation dermatitis tends to develop near the end of radiotherapy or even several months after it is completed. Other than the impact of radiation on the skin, it can also cause scars in the area to become tighter, muscles to tighten and weaken, bones in the radiation field to weaken, and it can potentially increase the risk of lymphedema. Radiation is also known to cause fatigue. So, what will physical activity look like when undergoing radiotherapy? During this phase of treatment, physical activity may change, but it is highly recommended to continue. Along with the strategies for fatigue reduction that I already mentioned, physical activity may now be focused more on muscle relaxation and gentle stretching, as well as introducing some simple strengthening exercises to combat the effects that radiation has on muscles and bones. If you have radiation dermatitis, you may need to focus more on light aerobic activity while your skin is healing. Lastly is hormone therapy. This is often used after surgery to reduce the risk of cancer recurrence. It is taken for at least 5 years and sometimes longer. Most, but not all, hormone therapies will lower the amount of estrogen in the body. As such, side effects can be similar to menopause, including hot flashes, night sweats, osteoporosis, and bone and joint pain. So, what will physical activity look like under hormone therapy? Keep in mind, hormone therapies often begin anywhere from 1 to 5 years after your chemo and surgery, and well into the survivorship phase of treatment. Therefore, the intensity of your physical activity in this phase may be able to be increased to focus on the long-term cardiovascular health and bone strength, as well as reducing your risk of cancer recurrence. You will be working your way up to 150 minutes of moderate to vigorous aerobic activity and aiming for strength training on 2 days a week. So no matter where you are in your cancer journey, there will be some form of physical activity that will be appropriate and beneficial for you. Now, I'd like to get Andrea to speak more specifically about the details of physical activity.
Thanks, Amanda. That was great. As Amanda was saying, the benefits of exercise during cancer treatment are vast. There's quite a bit of research now about how exercise reduces reoccurrence, increases survival rate, and has an overall improved quality of life. The information we're sharing today has come from a variety of reputable sources. We've looked at the American College of Sports Medicine's cancer-specific guidelines, the PAL, or the Physical Activity and Lymphedema Study, the Canadian Cancer Society, and BC Cancer Education Sheets. The PAL study is worth noting, as it's a very large study looking at resistance training for women with and without lymphedema for over 10 years of exercising post-cancer. General body exercises were performed for 12 weeks, twice a week, with very slow, progressive, resisted exercises. They found that the resistance training was not only safe, but also beneficial for women with lymphedema. This gives us great information that if you have lymphedema or you're at risk, slow increases of weights, 2 to 3 sets of 10, twice a week, is safe and effective. When you exercise, you're improving your heart, your breathing, your muscular function, your sleep improves, overall physical functioning is better. Improved bone mineral density, balance, and self-esteem, and also quality of life. Other great proven impacts are weight control, reducing depression and anxiety, improving cancer-related fatigue, and managing lymphedema. As long as you're adding variety to your workout, your body's going to change. Otherwise, it gets used to the activity and your body stays the same. So positive stress and using it in different ways makes change in the body. For example, you take the same route every morning walking your dog. You get used to this and it's kind of easy and your body's no longer being strained. One day you go in a different direction, which happens to be up a big hill. Your body will feel that the next day and probably even more the day after. You'll feel tightness in your legs and calves and maybe even sore in your back. But your body will be stronger because it was challenged. You definitely want to avoid inactivity. Movement is so good for circulation and helping the body systems run. A good place to start is using the FIT principle. F stands for frequency, or how often you exercise. This is at least 3 to 5 times a week, or daily if it's stretching and balance. I is for intensity. Regarding weights, playing around with the heaviness and reps that can be slowly increased over time. Intensity for cardio or aerobic activity is using your heart rate or rate of perceived exertion, which is a scale from 1 to 10. We call it the talk test. Low intensity, 1 out of 10, 2 out of 10 is a light activity. 3 to 4 would be more of a moderate. 5 and above, stronger activity. And above 7 to 10, you're kind of maximal level of activity. So if you are exercising and it's hard to talk, you're probably at a 7 out of 10. Type is which type of activity you choose and what you enjoy, like walking, swimming, biking, or lifting weights, whatever you like. And finally, time. So start small and build up. Even 10 minutes here and there can help. So that was frequency, intensity, type, and time. If you're playing around with these parameters, change will happen. Let's say you're in the middle or you're done your cancer-related treatments. Choose your favorite activity. Slowly increase the time and intensity. Build slowly to moderate and eventually vigorous. 150 minutes a week, which is roughly about 20 minutes a day. Weights needed to be added slowly and gradually increased. In terms of strength, it's best to perform your exercises twice a week with an individual, gradually progressive program. Rest days are important too, for your body to absorb the stress that you've put on it. Find a partner. It's always more fun to meet someone and feel a sense of community. Find like-minded people and have lunch or coffee afterwards. Make a goal, 10,000 steps a day, playing 18 holes of golf, getting out in that kayak, or even just to play with your grandchildren easier. In general, people with cancer have some degree of cancer-related fatigue that doesn't go away with a nap or a rest. Exercise, believe it or not, can actually improve this. I like Amanda's idea of logging your energy levels and paying attention to when it is a good time in the day for you to exercise. So, in summary, avoid inactivity, build up to 150 minutes of moderate to vigorous aerobic activity, strengthen your muscles twice a week, 2 to 3 sets of 8 to 15 reps, and daily stretches and balance exercises. Now that you've heard all of the benefits, we must cover some precautions. Shoulder movements. Most breast cancer patients have some sort of loss of shoulder function and movement. Tightness after surgery and radiation is common, but it doesn't have to be suffered with. After a simple surgery, usually within 6 weeks, you can start really stretching to get your motion back. Please follow your surgeon's guidelines if you have had reconstruction. You want to have almost full shoulder range of motion before you start strengthening. However, if your scars or muscle tightness prevent this, you can strengthen within your range as long as it isn't painful. There can be concerns over bone health. Some of the medications tend to weaken bones, and bones are also built with stress, so walking and balance exercises and strengthening can help with this. Bone mets. Take care with balance exercises and use supervision if necessary, as you can be more prone to breaking something if you fall. If you have a flared lymphedema or a new onset of swelling, please seek treatment from a certified lymphatic therapist. Early detection and screening is essential. Also ensure you have adequate compression and wear it during activity. If you have a negative response to exercise, like high levels of fatigue or pain, make sure to check in with a member of your medical team. If you're currently inactive, less than exercising 60 minutes per week due to treatments or side effects, make sure to speak to an exercise specialist with cancer exercise training before becoming active at a moderate level. It's important to follow any restrictions given to you by your surgeon, oncologist, or medical team.
So, if we had told you at the beginning of our talk today that you could take one pill, and that pill could improve your heart health, your muscle and bone strength, your fatigue and mood, as well as prevent cancer recurrence, would you have known that this pill was exercise? Exercise truly is medicine. It can be fun, enjoyable, and safe during and after cancer treatments. So give it a try and see what happens and what impact it can make on your life.
Thanks for joining us today.